Greetings to all, and thanks for joining us. I'm Dr. Bradley Wolf, Program Chairman of the 28th Annual International Society of Hair Restoration Surgery's Virtual World Congress that will take place October the 17th to the 25th, 2020 online. You are welcome to submit comments and questions during this live stream. If you are watching a replay of this live event, it was recorded on July 31st, 2020, and thanks for tuning in. Today, we are going to be talking about the doctor-patient relationship with one of the conference's featured speakers, Dr. Danielle Ofri, who will be speaking at the World Congress on Saturday, October 24th. She is one of the foremost voices in the medical world today who writes and speaks passionately about the doctor-patient relationship. Danielle is an essayist, editor, and practicing internist in New York City. She is an attending physician at Bellevue Hospital and clinical professor of medicine at New York University School of Medicine, who contributes to the New York Times as well as Slate Magazine. As an accomplished storyteller, she is also the author of 8 books about the world of medicine. Dr. Ofri, thank you for joining us today and during our World Conference in October.
Hi, thanks, Brad. It's great to be here.
Yeah. Well, we, as surgeons and doctors, we tend to concentrate so much on the technical skills and the science that at times I think we neglect listening to our patients. I know you're an expert at the doctor-patient relationship. Can you give us any advice about listening to our patients?
Well, if you think about, what are our patients' main complaints with the medical system today? It's usually, my doctor doesn't listen to me, or there's not enough time in the visit to say what I need to say, or I got home and there were 6 more things I meant to ask my doctor. And so even though it's hard to sort of shut our mouths and just let the patient talk, it's really worthwhile. When I was writing my last book, which is called What Patients Say, What Doctors Hear, I read about an experiment where they let patients talk uninterrupted, because we know that doctors tend to cut patients off within 8 or 10 seconds of them speaking. And so if you let the patient talk, how long would they talk? Well, actually, they only talk about 90 seconds. And so I tried it myself and let all my patients talk without ever cutting them off till they came to the natural end. And you know what? Most everyone got done in a minute or so. And even the one patient who talked on for what felt like 20 hours, she only spoke for 4 minutes. And then she said something to me afterwards. She said, just talking about it all has made me feel better. And you know what? That's the name of the game. And every future visit was much easier because I'd given her the time to talk. So don't be afraid to let your patients just talk for the first minute. Give them full frontal listening, eyes on the patient, no typing, not looking at the computer. And most patients will get out all they have to say. And it's like money in the bank for a good working relationship.
Yeah, I think it does. It does give the patient a more sense of trust. And that's, I think in this day and age where visits are short and you might not even see a doctor, that they want to know that their doctor cares and has invested in them and they want to trust us. So I'd like to let my...
that is also important. For my latest book, I've been working on a book about medical error. And one of the most difficult parts of error to eradicate is diagnostic error. Right? It's pretty easy to tackle procedural error. You have checklists for which side of the body you're going to operate on, but making a diagnosis, that's very hard to checklist. But I see when doctors cut patients off so quickly or don't listen to what they're saying, there's the making of diagnostic error. So even if not just for giving the patients a good experience, but for our end, for making the correct diagnosis, for not getting sued, for doing the right thing, letting the patient talk uninterrupted is really valuable for getting to the correct diagnosis.
In another one of your books, When We Do Harm, I know you talk about mistakes and errors and tackling those head on, and maybe you could speak about that a little.
Sure. There was a paper a couple of years ago that cited that medical error was the 3rd leading cause of death in the U.S., which I found kind of curious because I'm a primary care doctor in a huge city hospital. I should see it all the time, right? It's number 3 as much as heart disease and cancer, but I don't. And so I didn't know if that's because the data were wrong, or maybe it is correct and we just have blinders on. And one of the things in talking about the communication aspect of that, if you look at medical error, even just look at malpractice suits, the vast majority center around a communication issue. That very few are cutting off the wrong leg or doing something blatantly wrong like that. Most are about the way we communicate. So if just for self-interest, they don't want to get sued, communication is an important thing, but also for doing good medicine. I mean, we used to think of doctor-patient communication as, oh, bedside manner, right? You know, you got this nice doctor with a bow tie and they have nice bedside manner. And you'll hear, oh, so-and-so, great surgeon, lousy bedside manner. But you can't actually have those things separate. I don't think you can actually practice good medicine, whether it's surgical subspecialties, primary care, medical subspecialties, without good communication, because that is our best chance for minimizing medical error and improving patient safety and improving patient satisfaction. All that revolves around doctor-patient communication.
Yeah, in our specialty, it's really important to communicate, because every patient is different, and the treatment, what we're doing is pretty much the same, but the treatment has to be individualized, and that has to be communicated during the consultation. And what we deal with, you don't see as much in primary care, is patients' expectations. As doctors, we have to try to gauge what the patient's expectations are. You could have two different people with the same hair loss and the same hair, but they could have totally different expectations, and the way you manage those expectations can differ.
I think that actually holds for every field of medicine, because every patient has an expectation. Oh, I have this pain, I expect it to be cured. And, newsflash, lots of back pain, knee pain, it's not going to get cured. We can help it a bit, but many of these things are chronic issues of daily life, and how we communicate that. If we just say, oh, suck it up, it's just going to come and go, we will really damage, I think, our relationship and not help the patient. On the other hand, if we help the patient understand, the realities of, let's say, back pain, but also ask, how does that pain affect your life? And that matters, because for some patients, having back pain means they can't hold a job. And for other patients, having back pain means they have trouble, taking care of their children. And so understanding that and what it means for the patient, even if we can't solve it, and listen, lots of stuff we can't solve in medicine, understanding what the patient is going through and helping them gauge their expectations to a realistic thing for their life matters a lot.
Right. And in our patients, their hair matters a lot. So although it's not a disease, it's more of a condition. We certainly do face the same questions, the same fears, the same problems, kind of in a different way.
I think it's very essential, and certainly, patients who face hair loss from medical treatments. I mean, every patient who gets a diagnosis of cancer, their first question is about hair loss. It almost comes up before the outcome of the cancer. It's so terrifying, because it's just part of who you are. And I think we sort of, that's just a small side effect, but it's very central. And if we don't address that, patients go home feeling very scared about that and very worried, because that is, part of their self-definition. And we'd be remiss if we didn't, pay attention to what matters for patients.
Yeah, that's an excellent point. We don't see that as much, but that's a good perspective into the importance of what we're doing. We see it every day, and hair loss isn't a disease. A lot of people don't understand that it's very important to people, especially actually young men who are going to progress to a lot of hair loss, and women too. Women, and there's a lot of hair loss in women, and they're certainly affected by it, because it's not seen as a natural condition as men.
Yeah, and so I think we just go to the whole idea that we need to understand the whole sort of tapestry of the patient's life. When we teach our medical students and interns and residents, we talk about taking a social history, which often comes down to no tobacco, drugs, or alcohol. But in fact, it's so much more, and understanding who the patient lives with, their family situation, their work, where they've come from, what country they were born in, how they came to the US, where they live, what's going on in their life is critical. And when patients come in with all sorts of issues, if we don't understand that the greater sort of tapestry of their life, we won't be able to help them as much. And honestly, one of the joys of medicine is helping people feel a little bit better, even just by a few degrees. It's great when we can solve and cure things, but that's often pretty rare. But again, shifting the needle a little bit, and that helps to know what's going on. Often we can help with the things that extend beyond the office. We can struggling, with their jobs and their schooling and their lives, we can often offer advice, even if it's not directly medical, that can be very helpful for patients.
Yeah. Yeah, and that's pretty much what I think makes me keep going, is when a patient comes in and they're so happy and they say it's changed their lives, and all the positive things that has happened, and they've had no problems at all. It looks perfectly natural. I mean, that's pretty much the payoff. I mean, for me, I mean, I've done my job well, and they see a good effect from it. So we can, I mean, as opposed to maybe chronic diseases that you see, high blood pressure, diabetes, where there is a continual eating away of the body, we can reconstruct something, and it's all, if it's done right, and it should, with the patient in mind, it should all be positive. We're lucky in that regard.
Right. But the question is, how do we manage things when things go wrong, which often happens? That's the nature of medical practice. It doesn't always go right. Sometimes there are errors. Sometimes there's just they're just bad outcomes. And, it's very hard as physicians. Our tendency is to clam up, right? We don't want to be sued. We don't want to be embarrassed. We don't want to admit our errors. We're all perfectionists. But if you look, there's an interesting study that was done, and this was theoretical cases for patients, and they had a vignette where their doctor made an error. And would you fire the doctor or not? And the options were if the doctor told you the error or didn't. And if the doctor told the patient the error, what went wrong, they were more likely to keep the patient than if not. Mm-hmm. And you think it's a little bit counterintuitive, but I think that patients very much want to be able to trust their doctors. And if their doctors are straightforward, hey, this is what went wrong, this is what I did wrong, this is what didn't work out the way I wanted, they think, okay, now I know my doctor will be honest with me. Now I'm in safe hands because I know they'll tell me the truth. And we forget that patients are often terrified. They're very vulnerable. They may be embarrassed. They may be in pain. They may be ashamed of how they look or how they feel. And they need to know that we will be straightforward with them. And it's not always easy for us, but it's always the better route, because patients will value that and are less likely to sue us if we're straightforward with what's going on.
Yeah, I find that in our specialty the patients they do want to trust us. They're invested. They don't oftentimes know a lot about it. It's relatively new, although it's been around for 50 years, but the newer advances are new. So they need to be educated. I think that's a lot of what, in my consultations, what I do is I don't try to sell something. I try to educate patients and have them make an informed decision.
Yeah, and I think actually, education, you think about, what does a surgeon do, a general surgeon? They don't just operate. Much of that is talking to a patient about whether surgery is needed, whether it's the right thing, what are the risks and benefits. And that takes a lot of skill, communication skill, empathic skill, understanding the patient's perspective. And we put a high premium on the technical skill, but that really exists in a vacuum. And you really can't be a good technical physician without having the good communication skills, because there's more to surgical procedures than just operating.
Yeah, that is so true. That's why I wanted to bring you in and bring these points across, because we do get so caught up. We're in the rise of the machines as far as hair restoration goes, and with all the stem cells and all the medical treatment. I just wanted to kind of go back and look at the patient and their wants and needs. So
yeah, one thing I often ask my students is, can you practice medicine when there's a blackout? The power is down, or the EMR goes down. It's hard, but you can do it. It's pain in the neck. Can you practice medicine if you go to a developing country or under-resourced hospital? It can be harder, but you can do it. Mm-hmm. Now, what happens when you have to take care of a comatose patient, someone you can't communicate with? That's really hard. If you can't interact with the patient, get their story, understand what's going on, both the diagnostic clues, but also just the context of themselves and history, you're really practicing medicine with one hand tied behind your back, which points to the doctor-patient conversation as, I think, the most powerful tool we have in medicine, the most powerful technology. If you think about all the other technologies we have, which I love, MRI, CTs, echoes, they're great. They mostly do one thing in one way. But the doctor-patient conversation, it does all kinds of things. It's an incredibly flexible technology. Think of all the diagnoses you can get just from talking to a patient, even the treatments you can render from talking, the trust you can engender, the difficult discussions you can do about big ticket items, all of that with what the quote simple doctor-patient conversation. And we often give a very short shrift. We chat for 2 seconds and jump into the procedure, but it really should be the other way around, that the bulk of the medical care is in the talking to the patient. And then we add on the physical exam, the procedures, the diagnostic test, but that the mainstay is the doctor-patient conversation, which of course holds for nurses and other healthcare workers.
Yeah, that is so important. I speak to my patients sometimes for an hour, oftentimes, and some patients who can't figure, it's not really male pattern hair loss or female or inherited hair loss, it's some other thing. And then they've been to other doctors, dermatologists, and they really don't have a lot of concern about it. But just in talking to them and getting a complete history, not necessarily a physical, but just the history, it's surprising how you can find out exactly what's wrong. But it does take that talking to the patient, listening to them.
Yeah, and during the recent COVID pandemic, we were reminded of how important that was when it was really difficult to talk to patients. Talking to patients with an N95, a surgical mask, and a face shield. The patient's got a mask, the ventilator's on high, the patient's on oxygen, high flow. It's noisy, so you're each kind of screaming at each other to be heard. And you can really only do the most limited communication. And we also didn't have the benefit of touch. We could hardly examine or touch the patients. And so to be without suddenly, conversation and touch, you realize how limiting that is and how much we need it and how to help patients with their fears. It's a very terrifying and isolating time. And we didn't have those basic skills. I mean, sure, we had the x-rays and CT scans and the treatments, but we were missing the part of medicine that patients really value, not, instead of their antibiotics, but in addition to, and not having that, the lack was felt quite acutely.
I'm sure that was difficult. I've practiced in foreign countries, and when the lights are out, those are very important points. Thank you so much. We probably ought to wrap this up. It's been 15 minutes, so I want to remind everyone that they can find out all about you, see your books, the 8 books you've written on DanielleOfri.com, OFRI, and you'll be speaking at the lecture at the conference on October the 25th. And thanks so much for joining us.
Sure. I'll just take 1 second to mention the Bellevue Literary Review. This is our literary magazine that we publish twice a year. It's a nonprofit, fiction, poetry, and nonfiction about health and healing. Because I think there's also the benefit of the creative aspects to deal with all of the other issues besides the technical issues of medicine and healthcare, our fears or vulnerabilities. So please take a moment and check out the Bellevue Literary Review.
Okay. Thank you so much. We really appreciate it.
Thank you, Brad.
Make a few announcements to you out there that may be attending the meeting or interested in hair, that we will be broadcasting several live streams as introductions to our featured speakers leading up to the surgery and the World Congress in October. And a replay of this live stream will be available shortly to share. Also, registration for the World Congress is now open. Go to 28annual.org to register. There is ultra early bird pricing. And if you could, please share this event on your website or social media using hashtag ISHRS 2020. Thank you, Dr. Ofri, and thanks for all that have tuned in. And we'll be doing this again shortly with another speaker and another topic. Thanks again.
Thank you.